In 1879, a Brooklyn man named George Arthur Gardner spent 2 weeks in a state of indescribable suffering. By the end, extreme tissue decay had nearly severed his head from his body. The substance that triggered this decay was a standard medical tool. Gardner's dentist had packed his tooth with arsenic to deaden an aching nerve. This agonizing death represented a common outcome for the era. Dental practitioners routinely used arsenic to kill gum tissue and nerve endings, a practice that remained widely accepted well into the 20th century. This specific case reveals a terrifying historical reality. For centuries, the standard set of dental procedures shared the same basic chemistry as lethal poisoning. Pre-industrial oral health was defined by a state of constant decay. A full set of healthy teeth was exceptionally rare, and chronic toothaches were the expected norm. Patients lived in a complete medical vacuum. Treatments were performed without sterile instruments, without an understanding of bacteria, and without access to reliable painkillers. Blinding physical pain drove people to desperate measures. Sufferers willingly risked extreme blood loss or fatal sepsis for even a remote chance of relief. The historical record shows a thousands of years-long trap. The prescribed treatment for a toothache carried the same lethal risks as the infection itself. During the Middle Ages, tooth extraction was the domain of itinerant tooth drawers. These practitioners operated as traveling carnival barkers in village squares. They built chaotic, theatrical operating environments, featuring raised stages, elaborate costumes, and performing animals. This carnival atmosphere served a highly practical, sinister purpose. The blaring horns and beating drums were utilized specifically to drown out the screams of patients as their jaws were fractured by crude instruments. These practitioners relied on a primary diagnosis rooted in myth. A pervasive global belief held that tooth decay was caused by parasitic toothworms burrowing through the gums. Charlatans maintained this fiction through organized fraud. They hid real maggots inside their instruments, pulling them from the patient's mouth as fabricated proof that the worm had been extracted. This combination of extreme pain and total medical ignorance allowed a theatrical medical con to thrive for centuries. This vulnerability to hoaxes extended to the era's most educated elites. In 16th century Germany, prominent university scholars were easily deceived by obvious medical fabrications. One high-profile case involved a 7-year-old boy purportedly born with a supernatural golden tooth. The phenomenon completely baffled and intrigued the era's top academics. The case reached a violent climax when a local nobleman, frustrated by the child's silence, stabbed him in the face. The resulting surgery accidentally revealed that the supernatural tooth was merely a well-fitted golden crown. After the fraud was exposed, the 7-year-old boy was sent to prison. This case illustrates how the consequences of collective medical ignorance often fell most heavily on the most vulnerable victims. Beyond individual anecdotes, historical mortality data provides a clearer picture of the systemic mass death caused by pre-industrial dentistry. The London Bill of Mortality from August 1665 captures the staggering casualty rate during a single week in the city. Deep within the list of fatal diseases sits a category simply labeled teeth. In just 7 days, complications from dental procedures killed 113 people. This chart isolates the non-plague deaths from that week. It shows that dental-related fatalities accounted for nearly 10% of all routine deaths recorded in the document. These casualties were driven by botched extractions and the application of unsanitary concoctions. Open wounds were routinely packed with substances like ground lizard liver or raven's dung. Cosmetic treatments were similarly destructive. Early practitioners used pure nitric acid as a whitening agent, which achieved a temporary gleam by dissolving the tooth's enamel. The 1665 data highlights a brutal reality. For the residents of pre-industrial London, the dental chair was statistically a leading source of mortality. By the mid-18th century, medical forensics began to challenge centuries of entrenched superstition and fraud. A significant breakthrough occurred in 1757 when Jacob Christian Schaffer published a forensic exposé that finally debunked the toothworm theory. Following this, professionals began investigating physical causes of decay. King George III's dentist published research on the abrasive role of tooth powders and the corrosive properties of sugar. This shift toward physical evidence was the only intervention capable of ending thousands of years of mass dental casualties. Modern oral care is defined by sterile clinics, regulated instruments, and targeted anesthetics. Even with these protections, many people feel a deep, instinctive anxiety when sitting in the dental chair. Yet, against the historical evidence, a modern extraction is a triumph of science over systemic suffering. Modern dental care represents a hard-won escape from a millennium of torture, poison, and lethal charlatanism.